Are we good now?
Just a minute.
Yes, we are.
Okay, great. So, Kathy, we'll start by taking a roll call, please, to call the meeting to order.
Okay. Good afternoon, everyone. Rebecca?
Here.
Michael?
Here.
Eric?
Here.
Martha?
Here.
Dimitri?
Good afternoon, everyone. Here.
Secretary?
Here.
Nancy?
Hi, Kathy. I'm here.
Good. Matt?
Here.
And Rena?
I'm here.
Thank you.
Wonderful. Well, this is hopefully a very short but exciting meeting with an important vote. So I will actually turn it over to Audrey. This is not a typical board meeting, so we won't have a conversation or we can also talk. We can talk about anything, but there was a lot of material sent. But I guess the first item and the only item is an agenda is a presentation on ConnectorCare regulations. Audrey will kick it off, and Marissa and Andrew will present.
Great. Thank you so much, Secretary. And I will be brief, but just wanted to say good afternoon and thank you all so much for taking the time today for this special off-cycle board meeting to authorize the Health Connector to implement a historic new law that will bring new needed healthcare affordability relief to tens of thousands of current and future Health Connector enrollees over the next 2 years. In a moment, Marissa and Andrew will walk you through the proposed amendments to our ConnectorCare program regulations that will authorize us to implement a 2-year pilot program expanding our flagship affordability program, ConnectorCare, to more enrollees and residents. Before they do, I just want to briefly recognize how historic of an opportunity this is for the Health Connector, possible as a result of the FY24 budget that was signed into law by Governor Maura Healey last Wednesday. The Connector's mission, of course, is to make healthcare as affordable as possible for as many people as possible. And this mission is especially critical right now for 2 reasons. One, we are facing down the largest coverage transition, the ongoing Medicaid redetermination process that our market has seen in a decade or more. And further, 2, we continue to see healthcare affordability challenges strain ever more household budgets, threatening access to care and to financial security. So today we are asking for your approval on proposed regulation amendments that will allow us to comply with this new law that is providing new ways for us to address these real risks and challenges faced by the residents we serve using a program construct that we know is proven to work. The expansion of ConnectorCare to 500% of the federal poverty level for plan year 2024 and 2025 means that the cost of healthcare will drop by thousands of dollars for newly eligible people. It means individuals in the non-group market earning up to approximately $73,000 a year can save $4,000 or more annually on healthcare compared to what they pay now through premiums sliced in half or more and the elimination of their deductible. This is the first time since the Health Connector was created back in 2006, 17 years ago, that the Commonwealth has expanded state-level subsidy support for residents. On behalf of everyone at the Health Connector, I want to thank Governor Healey and the legislature for their support of this historic expansion and their vote of confidence in the Health Connector and the work that we do. As you'll hear today, we have a lot of work to do, but we are energized and ready to dig in and deliver for Massachusetts residents. But it all starts with today's presentation and vote, so let's get into it. And thank you all again for your support as we move to implementation. So with that, I will hand it over to Marissa and Andrew to take us into the details.
Thank you, Audrey. Good afternoon, everyone. So as Audrey noted, today we'll talk about the pilot expansion of ConnectorCare, and I'll just briefly review some of the program and expansion readiness, and then I'll hand over to Andrew to talk more about the regulation and the regulatory process. Slide. So just as a refresher, ConnectorCare builds on federal premium and cost sharing reductions from the Affordable Care Act and supplements them with state-level subsidies, currently providing affordable, high-value coverage to 143,000 individuals, over half of the Health Connector's total membership. ConnectorCare eligibility is predicated on an individual qualifying for federal advanced premium tax credits, which means they meet baseline eligibility requirements to purchase of being state residents, being lawfully present in the United States, and not being incarcerated. Beyond that, to qualify for subsidies, they also don't have access to other kinds of coverage like Medicare, Mass Health, or coverage through an employer. While the ACA set a cap on the income range to qualify for APTCs at 400% FPL, the American Rescue Plan from 2021 lifted this cap and allowed individuals at higher incomes to qualify, if a benchmark silver premium would cost more than 8.5% of their income. And this eligibility change is in effect for the duration of the pilot period. With the pilot, individuals will still need to meet all of these baseline ACA criteria, but they'll be able to access ConnectorCare plans with incomes up to 500% FPL instead of today's 300%. Next slide. So the ConnectorCare program has 3 different plan designs based on household income, plan types 1, 2, and 3. And within plan types 2 and 3, enrollees all have the same copays, but are broken into groups A and B to differentiate the premiums that they pay each month for that coverage. So everybody in plan type 2 has the same copay when they go to the doctor, but a plan type 2A member could access that plan for a $0 per month premium, while a 2B member would access that plan for a premium as low as $49. So to implement the pilot program, the Health Connector will add 2 subgroups to the plan type 3 benefit design, as outlined in green in this slide. Individuals above 300% and up to 400% FPL will be in plan type 3C and have a per member per month contribution of $219, while individuals above 400% and up to 500% will be in plan type 3D and have a per member per month contribution of $255. And these contributions and the actuarial value of the benefits provided is consistent with parameters outlined in the statute of 90% AB. And additionally, building on this plan type 3 design rather than creating a new plan design keeps us within the number of unique silver designs that we can create under federal plan variant template limitations that we're subject to. Next slide. So this design is the result of preparations that the Health Connector undertook over the winter to be ready to flexibly respond to the pilot if it passed. We were able to implement configurable logic in the HICS application over the winter so that we can modify the income cap and set the program parameters to include 2 new plan types. So that functionality has been tested. It was deployed in the late July technical release that just went live. And after today's regulations are discussed and filed, we would work with our systems teams to modify those configurations to be able to determine pilot eligibility for the 2024 benefit year. Additionally, every team at the Health Connector is working to move forward with pilot implementation. Today, we've touched on work from legal, IT, and policy and plan management, but operations is also working on call center materials. Communications is working through updates that will be needed to our website and other marketing materials, as well as external engagements with the sisters and advocates. And finance is reviewing and updating the budget as needed. So let me pause here before turning over to Andrew to see if there's any questions about this part of the presentation. All right, well, if not, I'll turn over to Andrew. Thank you.
Thanks, Marissa. I will now be walking through the emergency regulation process. So just to level set, we have a start date for this pilot program of January 1, 2024, and we need to have a regulatory framework in place that basically creates that pilot program per the direction of the law that was recently passed. Given federally required renewal and open enrollment processes, however, we need to begin program determinations that will take effect on January 1st, this month, really, to tomorrow. And so rather than follow the typical amendment regulation process that we normally follow, which can take 3 or 4 months, we don't have enough time for that. So we will be availing ourselves of the state's Administrative Procedures Act emergency regulation process. These regulations, if approved today by the board, would go into effect as soon as they are filed with the Secretary of the State. And that buys us 3 months to then engage sort of in the reverse order process that we would have normally engaged in, which will include a public hearing and receipt of public comments on the amendments. Assuming the board does approve those emergency amendments today, we will come back to the board after having that public hearing and ask for another vote that will either finalize the changes we've made today as is, or if there were additional changes based on the public comment, the board would vote on those changes, and in either case, final regulations would be effective thereafter. In terms of the particular amendments that the board is voting on today, we did share the red lines with you, but just to summarize, we are proposing to amend the eligibility criteria for ConnectorCare in the existing Health Connector program regulations. These amendments are very narrowly tailored to adjust the eligibility criteria, creating the two new plan types that Marissa described, one going from 300 to 400% of the federal poverty level, and the other going from 400 to 500%. We are also doing a little cleanup amendment here. We had an erroneous cross-reference that we're looking to correct that we caught when we were doing this review. So that is also included in the amendments we're proposing that the board vote on today. I'm happy to pause and take any questions about the particular amendment or the process around making these amendments if the board has any.
Any questions for the team? I actually was going to ask Audrey to comment on one question that I had while we were contemplating this as it was moving through the legislature, and it's the relationship of this product to the small business market for employer sponsored insurance, and a concern that maybe this would be kind of could cannibalize that, and you very quickly dispelled me of that notion. So I thought maybe the rest of the committee would be interested in it. Or maybe I was the only one who was carrying the misunderstanding. So, but.
Sure, I'm happy to speak to that. So this is coverage that's only available to people in the non-group market. So people who are already in the non-group market or are already eligible for non-group coverage but haven't enrolled with us for whatever reason, and people that may be coming off of Mass Health during the redetermination process. This is an entirely individual market construct. ConnectorCare as it is today and as it would be under the pilot itself. Health Connector for business and the small group market, an entirely different animal and market segment. And important for folks to know, as Marissa noted, to be eligible for ConnectorCare, again, as it is today or under this pilot construct, one cannot have access to affordable employer-sponsored insurance, either be in it or have it made available to them. So completely different, there's no sort of cannibalization occurring. But appreciate that question. Happy to chat more about it if folks are interested.
And then the other question is the duration of the pilot and what kind of how we would work with members who if the pilot were to go away. Obviously, we hope it doesn't, but I think we should be clear-eyed about that as a board as well.
Sure, happy to. So if we do get to that point that this needs to be rescinded, the pilot expires, obviously that's a tough communication to share with people, the removal of assistance, but there's some precedent for that in our market in different ways. We've had to reconfigure programs in the past. And so for better or worse, we have experience communicating to people about changes that affect their premium. Most people in the market, their premium changes each year. So that's something we have experience with. Again, those are tough conversations, but one the connector would be positioned to handle.
Thank you. Nancy, I'm sorry, I didn't see your hand up.
Oh, that's okay, Secretary. What's our best estimate? And I know it will be in some ways a guess as to how many people we think will be eligible for this new pilot and how many might actually enroll.
Sure. So, we continue to update our forecast based on redeterminations because each month we're getting new information about who's going to be in the individual market on the other side of redeterminations. But our walking around number has been about 50,000 people that are current Health Connector enrollees or people that are currently eligible but unenrolled for non-group coverage through the Health Connector that we think would fall in between 300 and 500% of the federal poverty level. Including people, again, who may be making a transition over the course of the next 8 or so months as a result of the redetermination process. But again, we continue to refine forecasting in general because we are in such kind of an unprecedented time of a lot of change with people migrating from one coverage source to the next. But that's about where we are today, around 50,000 lives is our estimate, again, including both current enrollees and future enrollees.
And Audrey, about how many of those do we think will be kids? I mean, that'll be a fairly new population for us since kids below 300 are Mass Health eligible.
It's a good question. My understanding is that we expect a fair amount of folks between 400 and 500% of the federal poverty level could be families, like couples and families. And you're right that current day ConnectorCare has very few children because CHIP comes up to 300% of the federal poverty level. So there could be some different kind of configurations of household. I can get back to you on more specific numbers on that though, but I think it's an important area for us to be mindful of from a policy perspective, because that would be a newer dimension of ConnectorCare. The good news is ConnectorCare has very robust network adequacy and other consumer protections. So I'm not concerned about, coverage not meeting the needs of families. That's part of what is so important about ConnectorCare is how protective and consumer centric it is. But we can get back to you with more specific numbers about households with child dependence.
Yeah, and it was the network adequacy when we think about younger people that was on my mind. So you read my mind. It'd be great to get any information we have about that.
Absolutely. And I'll just note that the fact that this pilot will be rolling out at the exact same time that we have the last 3 carriers who've been kind of holdouts in the ConnectorCare program will be entering the program. So families, whether it's, adults with no kids or adults with kids, there has never been as much choice in the ConnectorCare program as there's about to be at the stroke of midnight on January 1st, 2024. So there were, the full range of networks that anybody else would have access to in the marketplace will be available to those families.
Will they be CHIP kids coming in probably?
There
No?
shouldn't be CHIP kids coming in. So any kids coming into the program would be kids we're already covering today in the non-group market or would be coming off of Mass Health and are no longer CHIP eligible.
Okay. And then do you want to say one more thing? Marissa touched on it, but my understanding and part of the reason we're having the call today is there's a fairly significant operational lift for you and the team. Any worrisome things or things you want us to know as you go into this? Really, it's wonderful that we're expanding coverage, but it's a lot of work for you guys. Do you want to talk a little bit more about that? It's your chance to whine.
Sure. So yes, it's a lot of work, but I will say there was a lot of work done as contingency planning because we were watching this make its way through the legislature both last year and again this year, of course, through the budget process. So a lot of the heavy lifting on the system side of things is done because as Marissa noted, we sort of set up the system to be configurable. And those are changes that have been tested and are ready to go. I think from an operational perspective, as Marissa noted, we're going to certainly have to make sure our call center and our navigators and our sisters and others have all this updated information to communicate to people as they're making their way through these changes. People who are today not ConnectorCare eligible, but are in marketplace coverage and are going to go through this change and making sure they understand this is a good change and what it means for them, as well as making sure we're communicating to the public more generally in terms of our communication strategy to make sure people know about this and that this is a real benefit on the table to them. So it is a lot of work. I won't deny that. I can't say there's specific worries I have from an operational perspective because of how much work the team did to get ready so that we have this turnkey ability to press go upon passage of the amended regulations.
Thanks, Audrey and team. Are there any other questions? I don't see any hands raised, but anything else?
Actually, I have a quick question, maybe just a quick information. I wanted to get some clarification with regard to the communication strategy around this. And is this a situation where we need to create awareness of folks who potentially qualify for this so that they're aware of the program? Or will this simply be an option that if they go shopping online, that's going to pop up that we don't need to communicate anymore about?
A great question, Dimitri. So what our system will do for the tens of thousands of people we can already see today are covered through Health Connector coverage, but will become newly eligible for ConnectorCare. Our system will send an automated notice to them saying, congratulations, you just became ConnectorCare eligible, even if nothing changed in their household circumstance, their income or the rest. So they will be communicated to immediately. And then they will start to get messages from the connector about what that means, the protections that come along with ConnectorCare and any other facets of it that we need to update them on. So that communication will get set into basically automated motion when we hit go tomorrow if the amended regulations are approved. And then I think the second piece of that is the population that is not with the connector today and how are we communicating with them. So Jason and team have an entire communication strategy ready to go that involves broader communications and outreach to make sure folks know there's this new help available. Of course, that's particularly important right now as folks are coming off of Mass Health. For the connector to be able to say truthfully, there has never been more help available to the people in the Commonwealth of Massachusetts through the health connector as there is today, when the need is so great because this transition is occurring. That's a very powerful communication message that we have that will be going into full force this fall through our communication strategy. And as you all know, thanks to the support you've given us to be very loud and assertive out there across the entire state as a part of redeterminations, we have many, many homes that we can put those messages. So I'm not concerned that we won't be able to reach people that, again, maybe sitting on that eligibility and ready to, able to come in and take advantage of this benefit, but are sitting on the sidelines and haven't enrolled yet. I think we have the right toolkit and the right resources, frankly, to do that effectively.
Thank you, Audrey. So those who are already with the connector will be automatically opt-in.
That's correct.
And Jason will do his magic to make sure that folks who are not with the connector will be aware of the program.
That's correct. That's exactly right.
Thank you.
Thank you.
Anybody else? Sorry, Dimitri, I didn't see your hand up. I wasn't looking in the right place, but now I see it.
No.
Okay.
Now I just have to try to
Rena,
take it down.
Okay. Rena, do you have a question?
A question. I just have a comment, which is I think this is fantastic. And I think that as a community, we should be incredibly grateful that we are able to do these sorts of things. I have worries about what everything looks like when this pilot is over. And I just hope that as a Commonwealth, we can spend the next 2 years focusing as much attention on the cost of healthcare as we are spending on access to an unaffordable healthcare system, so that we don't have to make tough choices in 2 years.
Thank you, Rena. Agreed.
I just approved the quote. I wished you'd said that. I would have added it to my quote. Thanks, Rena. Any other comments? Okay, if we want to just turn to the slide that has the actual language of the board vote, if everyone could read it. Can we go back to that slide, because we're going to take a vote on that. Can we go back to the board vote? Thank you. Okay, I'd like to call for a vote. And wait for Kathy to call your name, please. Oh, first we need a motion and a second, sorry.
So moved.
Seconded.
Seconded.
Okay. Okay. Everyone's so polite. Thank you, Matt and Michael. Now it's time for the board vote.
Okay. Rebecca,
Yes.
Michael,
Yes.
Eric,
Yes.
Martha,
Yes.
Dimitri,
Yes.
Secretary,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena.
Yes.
Thank you.
Okay. I think the motion has definitely carried, and I think my only official business, if there are no further comments or instructions from Audrey and the team, is to ask for a motion to adjourn.
So moved.
Second.
Thank you. I think, Kathy, can we do a vote now?
We sure can. Rebecca,
Yes.
Michael,
Yes.
Eric,
Yes.
Martha,
Yes.
Dimitri,
Yes.
Secretary,
Yes.
Nancy,
Yes.
Matt,
Yes.
Rena.
Yes.
Thank you.
Well, I want to thank the Connector staff for pulling this together on short notice. Apologize for my difficulty. I was just talking to myself on Teams until somebody rescued me. But and I really thank them for all the work that got us to this point and all the work that follows to make sure that people can have access to healthcare coverage. I really think it's a great day for our state. And thanks to everybody for all the great work they did. And for those of you who interrupted your vacations, a special thanks, so we can get this vote going so the team can get to work.
Thank you so much, Secretary, and to the whole board. This is wonderful.
We'll see y'all soon. We'll see you at the next
Bye,
meeting.
everyone.
Thank you. Bye.
Thank you.
Thank you.
Bye, everyone.
Bye.